I made a video for Liam Hendriks and I tried to support him and try to get him to do good and just go through it.
Hey Liam, you're not alone. I got diagnosed with osteosarcoma bone cancer in April. And to this day, I'm battling through trials and tribulations to keep me happy to this day. And if I can do it, you can do it too.
The day that I found out my son was diagnosed with osteosarcoma bone cancer, it was very devastating. Like a building collapsed.
When I was doing chemo in the hospital, I just wanted it to be over so I can go back to school, go back to normal like a normal kid.
Dimitris was having pain for a little while in that leg, and fortunately we were able to diagnose early what was going on. And unfortunately it was an osteosarcoma, which is a very rare cancer in bone. We happen to be specialists in it here in Rush, and we have a really full team for treating osteosarcoma of orthopedic oncologists, medical oncologists, pathologists, radiologists.
My time at Rush was like, it was kind of sad, but it was like, at least they were there for me. And it made it like more like of a fun experience with my nurses and stuff.
He had to have chemotherapy for half of his treatment, and then they would have to give him surgery.
We really focus on limb salvage surgery here 99% of the time in cases of cancer like this, and the reason for that is for quality of life. Patients with functional limb are able to partake in so many more things than those without. You know, the decision of the family that was best for him was the reconstruction with what's called a modular oncology device, or basically a very large metal replacement of the part of the bone we take away in the knee joint. And this new device actually has the ability to grow as he grows. His other leg is a normal leg and it has growth plates. He's of an age where his leg keeps growing, and if we just put in a plain metal implant to the side that we take the bone out of, that leg is going to be shorter than the other leg because the growth plates are gone. We're using this non-invasive magnet to very slowly grow his leg as his other leg has been growing. Just to give him symmetric size legs, length legs, so that when he walks he has more of a normal gait and more of a normal looking leg.
It feels like a small, like a itty bitty vibration on my leg, like all around my leg around the machine. Like, and it like feels like my muscles like tight, like I just got done with a leg day.
Fortunately, it's a very painless procedure. He comes in every couple of months to have a lengthening of just about 3 to 5 millimeters each time. We get some x-rays on the way out just to make sure that his lengths are looking okay. And the goal here is just to match his other leg as he's growing. And this device works very well for this purpose.
Me and my son, we actually lived at Rush Hospital. They made this experience, this very traumatic experience, better.
My last birthday was exciting because everybody was nice to me. The chefs in the kitchen, they cooked me like some special food and cupcakes out of the kindness of their heart. My nurses bought me stuff and made me snacks and stuff. It was all just perfect. I feel proud that I can tell like someone with cancer that if I can do it, they can do it. Try your best, go through it, persevere, and just keep trying.
He's really doing fantastic, so I think he's going to make the full recovery and show us that he's going to do great things.
Let's go!